Welcome to another episode of Clinic Success Secrets, podcast where we uncover the strategies and insights that drive clinic growth and elevate patient care. I'm your host, Tommaso Dwyer, founder of Clinic Success Partners. We're a medical digital marketing agency dedicated to helping clinics serve more patients and achieve the success that they deserve. Join us as we dive into expert advice and success stories from clinic owners and healthcare leaders from around the world. Today, I'm honored and excited to welcome Demilade Adeniyi. I apologize if I'm mispronouncing, CEO of Clinically Handy, a virtual assistance company that provides essential administrative support to healthcare professionals. Their expertise is transforming the healthcare industry by streamlining operations and allowing providers to focus on what truly matters, patient care. In this episode, we'll focus on the future of healthcare administration and how technology is reshaping the way clinics operate. That being said, Demi, welcome.
Thank you so much. I'm so happy to be here. I'm excited to talk about healthcare administration.
Uh, Before we dive into the actual healthcare administration side of things itself, would you mind sharing a bit about your own background and how you ended up where you are today with Clinically Handy?
Yes. So I actually go by Demi, which is I think is a lot easier for people to pronounce. I am a Nigerian, and I came to Canada and I started school here. And to be honest, I thought that I really wanted to go into business, but I also liked medicine. So it was kind of a tussle between going into medicine or going into business because I really loved both of them. And I thought that the only way I could be in medicine was by becoming a doctor, which is not true. There are other parts of medicine that people don't really know about. So I went into business anyway. And when I was done, um, I had this like urge to just go into medicine for some weird reason. So I thought, I would just do a couple of trainings here and there. So I took a couple of certifications. And then I started working in healthcare as an administrative. I started with working with peds. I started with working with um, naturopathic medicine, chiropractic medicine, and nutritionists. And then eventually, when I moved to another province, I started working with dermatologists, internal medicine, and neurology. So, to be honest, I've been in healthcare administration for over 7 years now. And it's something that I love and I'm very passionate about. I feel like that's a part of medicine that people do not see, especially like during the pandemic, where people were wondering if healthcare professionals in bracket are also healthcare administrative people as well. Are we considered healthcare professionals because we're working behind the computer? So it was just a very interesting career to go into. I know people don't really know much about it, but I'm here to kind of shed light on it. And to show that this is a healthcare profession. This is something that I love doing. There's a lot of work that goes into managing doctors, managing healthcare professionals, managing hospitals, managing clinics, the behind the scenes of everything. Doctors and nurses, they're the stars, but we are the production managers and executive producers.
I love that. And again, it's a great metaphor when you think that the whole stage comparison, you're obviously always going to have the front of house, so to speak, but
Yeah,
that's not possible without all the hard work that's done behind the scenes. Uh,
exactly.
so again, I'm delighted that we get the opportunity to actually unpack some of what that behind the scenes looks like, and ideally for any clinic owners here, you know,
Yeah.
by educating them on some opportunities for improving their administrative processes, hopefully they can buy back some more of their time and run a more efficient and effective enterprise. So, with that being said, uh, clinically handy, what exactly are the core services that you offer to medical professionals? And what are some of the most common tasks that you find people need help with?
So right now at Clinically Handy, what we offer essentially is a virtual administration. We focus mainly with telemedicine for now. So we do virtual administration, we do billing for doctors, we handle transcription services, doctors that require translation services, and scribing services as well. So those are our core main services for now. That will be changing shortly, but for now, those are what we kind of provide for healthcare professionals who are in telemedicine or prefer to have their administration virtually.
And within that, with the transcription, translation, and all that sort of thing, how are you leveraging technology to streamline all of this and improve patient outcomes?
So to be honest, um, right now, medicine is going in a different direction. The pandemic has shown us that medicine can be practiced virtually. Before, it was kind of you need to go to your doctor's office to, see your doctor and do everything that you need to do, which you still need to do because some tests can't be done virtually, of course. But when the pandemic happened, people realized that, okay, maybe some things we didn't have to go into the doctor's office for. And because that happened, that opened the gateway for us to be able to work virtually. So be able to do transcriptions virtually. Doctors can actually send through platforms online. Um, Depending on where you're located in the world, there are different platforms that you can use that serve as transcription services. One of them is 3D. 3D is one of the ones that we used in the previous clinic that I had worked with. So doctors can pick it up, do a quick transcription, and everything is transcribed and sent back to the doctor as their notes. And then the virtual assistants, on the other hand, will basically upload that into the patient file.
Perfect. And within that, then I suppose that addressed that component. Bringing it back to the clinic owners, again, they're probably wondering where does Clinically Handy or similar services fit into the whole organization? What are the actual benefits for clinic owners? In your experience, what impact does virtual assistants have on healthcare operations, especially small practices that are maybe just getting up and running, where the clinic owner is wearing multiple different hats? Where do you fit into the bigger picture, and where is it most useful?
So, for Clinically Handy, where it is most useful, especially, is for doctors that are just starting up, right? When you look at the cost of having a clinic or managing a clinic or even starting a clinic, right? Some of the things that you have to look at is administration. People are going to walk through the doors. The doctor cannot greet the people at the door and do all of their intake, do all of that stuff for them, right? So where we kind of come in that sense is that we are able to actually handle all of that for you. We can take that responsibility off of you in the sense that we can create platforms for your patients to be able to, sending all of their information ahead of time. One of the examples that I always use is this one clinic that is in Regina, Saskatchewan. In Regina, Saskatchewan, we have this one dentist who I'm not going to mention here for privacy sakes, that he has an assistant named Austin. Now, nobody has ever seen Austin before, but Austin calls all of his patients. Austin takes all of the medical histories before the patient arrives. Austin reminds patients about their appointment, but he is personable. So the thing about medicine is that we can't extremely remove make it completely virtual, but we can have some aspects of it as virtual. That way, patients are still able to feel a connection with their practitioner. And also that way, doctors are still able to save more. So we're kind of in between, kind of sandwiched in between, if that makes any sense.
Hmm.
So, like I was giving an example about Austin, right? So he does all of that stuff. When you go in for your appointment, I actually use this doctor in particular because I love how his technology works. I go into the clinic and instantly, like, I just have to go into the iPad, activate myself that I'm here, and the doctor calls me in and says, "Oh, Demi, come into room one," and my appointment just begins from there, right? So Austin does all of the transcription. Austin does everything. Austin, when I'm leaving, Austin is like, thank you for coming for your appointment. I get notifications about that. We no longer have to have that whole desk in front of the table where you're like checking in or like sitting down and writing all of those
Yeah.
forms. Those things are becoming outdated. Now, in that case, that is a doctor, I think, if I'm not mistaken, I believe he just graduated about 3, 4 years ago.
Mm,
Now, he has Austin who's able to save him all of that cost. On average, he'll probably need, at least for the amount of clinics that he has, probably 2 to 3 or 4 receptionists that he will have to train consistently. This is the new protocol. This is that. This is this. They're sitting in front of the desk, you're answering the phone calls, all of that stuff. He has eliminated all of that chaos that happens when you
yeah.
enter the clinic and made it so seamless for your patients in and out, right? So that in a sense is where technology is moving, and I believe that eventually it is going to move to a point at which things are going to be a bit more automated. Maybe you might not even need Austin at that point. He might just be fully run by some AI or technology. I'm sure there is AI to speak to that fact, but right now that is where we stand with Clinically Handy. We are able to do that for you. We are essentially able to be your Austin, right? Um, the assistant in the air, in the clouds. Nobody has to see us, but we handle everything so it makes you look good as a doctor, as a practitioner. Your patients still feel connected to you in the sense that it's not AI that's talking to them, so they don't feel like it's a robot that's like managing all of their stuff and all of that stuff. But there is somebody somewhere that is handling all of that. Now, of course, there are downsides to that as well. But when we get into that, then we'll discuss.
I love this, and I think definitely, I'm sure anyone listening here, their ears are probably perking up because, as you said, if you're raised as sort of the technician and you're all of a sudden this entrepreneurial or managerial role in the
Mhm.
business, you're probably wondering where can my actual resources go, and the idea of having someone to just that you can delegate that client facing or patient facing side of things is probably music to their ears. So I'm looking forward to going into how that actually works. But let's just sort of rewind or even fast forward, probably a better term to use here. The future of where you see this going. You know, we touched on, obviously, in the case of Austin, down the road, it could be the case where he's replaced by an AI or so on. How do you envision or see telemedicine and remote care, you know, shaping the future of healthcare? What direction do you see this? Say it's 5 years down the road. We're in 2029 or 2020 or 2030. What do you think that looks like within healthcare administration?
So within healthcare administration, there is a very high chance from the way things are going. I've had so many meetings with so many people that have created so much technology now that you're just like, oh my God, like, are we ever even going to be needed anymore? Um, there is a possibility that we might have a situation where AI kind of takes over control of healthcare. Well, healthcare administration, because you know, you still need people
Yeah.
to operate those robots somewhere. But there's possibility that this will probably reduce, how much of work that a healthcare administrative people will have to do. But I don't think we can be completely eliminated because technology isn't always perfect. 5 to 10 years from now, what I envision anyway is that there will be AI technology that will take over transcription services if they're not already doing that, taking over transcription services, scribing services. But think about it in this way. If I'm a doctor and I transcribe into a machine, which is what they currently do, some doctors already do that already. And this machine kind of works like Chat GPT, where you tell it something and then it writes exactly what you've said, right? There are um, cultural things that those technologies cannot catch, from doctor to patient. If you understand what I'm talking about, that a person who's working as an virtual administrative assistant in transcription would be able to catch. So again, AI can't really catch certain things about human emotion. It can only catch what you've told it, right? There's that aspect of things. Number two is also the correctness rather of AI, right? We have to also understand that when you're transcribing something, if I'm a Nigerian and I have a strong accent, I might say, oh, I might pronounce a word differently from how you will pronounce a word, right? Now, will AI be able to catch those words? So somebody still has to go back and look through to make sure that what the AI essentially has transcribed is exactly what the doctor has said. So in that situation, you can kind of see how there is still a need for that virtual assistant to kind of proofread, go through to make sure that, okay, we have what everything that you said is what you said. We kind of caught those mistakes along the way, right? So from a cultural perspective, right, different doctors come from different races, different doctors speak differently. When you are, for example, even with my iPhone right now, when I'm talking to Siri, sometimes when I use my Nigerian accent, Siri doesn't understand what I said. She goes off and does something else on her own, right? So imagine that in medicine. We don't want to make that mistakes. So we can't completely ever, I don't think, eliminate virtual administrative assistants and what they do. What we can do is maybe there might be a reduction in the number of people that are in the profession, for example. So the number of tasks that have to be done. It's essentially going to be sort of like an aid to help, right? To make things faster. Rather than me listening to a transcription of 60 minutes and typing as, as fast as I can. Now AI can do that, and all I have to do is just proofread it, which is what is happening right now. So in 5 to 10 years from now, I do believe a lot of tasks will there'll be a reduction in a lot of tasks for virtual administrative assistants and for healthcare professionals on the other side. But I don't think that it's going to be completely eliminated. The healthcare profession is a profession that really requires person to person connection, right? You can't really eliminate doctors, you can't eliminate nurses, you can't eliminate the healthcare administrative. You don't want to go to the hospital and like AI is talking to you and saying, you're dying of something, God forbid, like cancer, and AI is talking to you and telling you everything's going to be okay. It sounds kind of weird, right? You also want a personable experience. You want to know that the person that's on the other side is human and empathizes with you and sympathizes with you and understands, what you're going through. So, yeah, 5 to 10 years from now, definitely a reduction in the profession or the number of tasks that, doctors, healthcare professionals, virtual assistants might be doing, but it does not completely eliminate the profession completely, unlike other professions, unfortunately.
And rewinding back to today, Demi, then I suppose for clinic owners now, how can clinics start integrating these upcoming technologies into their daily operations? What are some ways they can sort of start drip feeding, that transition into being more tech savvy?
Yes. So, one of the things that I love the most is technology because it has made life easier for healthcare professionals. I know healthcare professionals, all they want to do is always practice medicine. They don't want to change the systems. They're like, I'm just going to use my fax machine and I don't, and all these old technology. We know they work, but essentially what we want is faster service. The wait list currently for a lot of specialties is increasingly alarming. I was discussing with someone the other day, and that was one of the topics that were brought up. How can we reduce this for healthcare professionals? The truth about the matter is, it's time for healthcare professionals to accept that technology is here to help. So there are platforms that they can get on. One of them that makes life easy is Accuro. Accuro, for example, makes life easy. There are okay. I don't know if I can see this because I don't want to sponsor sponsor these brands, and I know this is going on a podcast, but there are brands of transcription services that doctors can use. So I can give a list of them, with
Yeah.
Tomas's permission.
Yeah. Far ahead. Far ahead.
Okay, good. So there are platforms like Akuro, there are platforms like MedAccess, there are platforms like Karmasoft, MindBody, there's Jane. One of the clinics that I've worked with in Toronto, they use Jane and Jane works beautifully. Jane is so automated to the extent that it reminds your patients about your appointments, so you don't have to. I went to another clinic in Regina and nurses were still calling patients. I was like, that it takes for you to call like 50 patients. Do you know how much of that takes like at least probably
So
like 30,
it's a
40
lot of
minutes.
hours.
Yeah.
Yeah.
And if the patient doesn't answer, you're calling back again. So imagine a platform like Jane where, you're able to use Jane. Jane automatically sends a message to your patients, letting them know just a reminder about your appointment for today. Yada yada. These are the stuff that you need to bring. All of that stuff, right? Then you don't have to have all these receptionists calling patients or whatever. These are automated services. Doctors can use this. There are another clinic that I worked in again. They also use Jane as well. Jane's a beautiful platform. It once a patient is scheduled into the system, it sends the patient an intake form into their email addresses where the patient can fill out the intake form prior to their appointment, right? So when the patient comes in, they're not necessarily waiting for an hour. That 30 minutes that the patient is coming in for is 30 minutes used on that patient, and the patient is receiving adequate care. In North America, where we actually work in, right? Doctors are currently reviewed by patients. So if you go online, if you go to reach your doctor or whatever, you see all these horrible reports about doctors. Why? They say, oh, my doctor is not paying attention to me. When I come into the clinic, my doctor is on his computer going typing, typing away. He's not even looking at me. My doctor prescribed me something, but didn't even, empathize with me. Patients want you to empathize with them. They want to understand as a healthcare professional that you feel what they're feeling. You understand what they're going through, right? In order for you to be able to do that, you need time. And I understand that as a doctor, as a healthcare professional, sometimes there isn't enough time. You're seeing 30, 40 patients. What we try to do for you is cut that time into half. So basically, with all of this technology, you can do that. You don't have to do, the whole while the patient is there, you're typing and talking and all of that stuff. You can actually look at the patient, focus on the patient, hear their concerns, empathize with the patient, all of that. Like I said, Jane is a really great one. I was very impressed by their service when I was in Toronto at the East End Family Wellness. And I was very impressed at how these services, you can actually automate them to fit into what you need as a healthcare professional. There's also ones like MindBody. There's ones like Karmasoft. MindBody especially works for people that work in massage therapy or any other external service that is not necessarily a core medical service. So acupuncture, chiropractic, naturopathic, and all of that, right? So these are essentially services that are good for you as a healthcare professional. And I think it's about time that we leverage on these services.
Perfect. And I suppose with regards to actual challenges then that these healthcare providers are facing, uh, great to know about Jane and all these other powerful software solutions. But the actual challenge that in your experience that healthcares are facing, what do they look like? What are the biggest opportunities for buying back the time of clinic owners that you see with your current client base?
So for the current atmosphere that we're currently in, right, and the current experiences that healthcare professionals are facing, one of them is obviously time management. I'm sorry about that. My pen just time management. So it is important that we are able to create time for doctors to be able to do other things. I know people are like, oh, my doctor forgot to send my prescription. My doctor forgot to do this. My doctor forgot to do that. Time, doctors, they don't have time. You're literally running from one patient to the other patient. The first thing we need to do essentially is to cut down the amount of time that, that that, because for example, say I have 1 hour, and in that 1 hour, I have to see 8 patients. I have to do everything for these 8 patients, right? Um, Essentially, what I would need is, okay, you know what? I have 8 patients. This is how much I'm going to be getting paid, because medicine is actually still a business. Think about it this way. Yes, I'm a doctor and I want to save your life. Yes, I'm a nurse and I want to save your life, but I also have bills. I also have to be able to pay for the cost of my clinic, my establishment. I also have to be able to pay for all of this stuff, right? So how can I be able to manage my time efficiently that, I am able to be able to get benefits for the work that I'm doing? I don't want to be oversaddled with work. I don't want to be overloaded with work. So for example, one of the issues that they face is, being able to have that time to be able to do their billing, to be able to do their scheduling, to be able to, see the patient and have patient interactions. That time constraint is one of the issues that they face. Another issue that they face is obviously billing and reimbursement. Now, this is a very, very touchy subject for a lot of doctors. Here in Canada, a lot of doctors do their own billing, which means a lot of mistakes are being made. And what happens is they end up getting in trouble with the College of Physicians, right? They send you a message and then you have to appear in court and it is trouble. So imagine a world where you are able to see your patient and somebody else does the billing for you based on what you're seeing the patient for. It can get confusing sometimes because a lot of doctors don't even know a lot of the codes that they're supposed to be using. I know a doctor personally who worked for 2 years and underbilled for all of her patients for 2 years, losing over $100,000 because she didn't know the codes.
Thrown
So
away.
yeah. So you are trying to essentially save, in quote, money by not paying somebody else to do that service. But are you really saving money if you're losing $100,000? You have to really kind of weigh those options there, right? So as a service like Clinically Handy offers, we're able to help you do your billing for you. Now, some billing services collect percentages like 20% of what you've earned, which I think is a bit ridiculous. Personally, I feel like, it should be personally. I can't speak for any other company. So, but I feel like that's a bit too much. But having someone else handle your billing and reimbursement services helps you, be able to monitor like all of the cash flow. How much is coming in? How much is going? How much are we spending on resources? How much are we? You don't have to worry about that. At the end of the day, you get like all of the spreadsheet, all of the reports, just letting you know this is how much we have spent, this is how much came in, this is what we billed for. If there are now any corrections that need to be made, then you can now step in as a doctor and be like, oh yeah, I saw this patient, I did do more than this or whatever. And then we can now send additional letters to the college, or the ministry rather, letting them know that, this doctor did more than, what we initially billed for, yada, 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 right? Another issue that they face, there is many, 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 many things, is a managing of medical records. Now, ideally, doctors want to do things the old way. You want to write in a tract and then keep all that paper and then put it somewhere. Now, the law states that you have to keep this, well, depending on the age of the patient anyway, but maximum of 10 years, right? Depending on the age of the patient, for I think patients that are lower than 18 years, you have to keep them for 10 years. If the person is older than 18, you 7 years. So now, what happens when, for example, your clinic catches a fire? What happens to all the patient charts? So the thing
Trouble.
is, yeah, everything goes. Now, if, for example, God forbid, something happens to one of your patients, there's a fire, we can't catch that medical history back again. It's all gone, right? So again, this means you now have to leverage on the use of technology, right? You're able to kind of store this in server studies, in platforms that allow you to be able to have that chart for extensive period of time. Another thing is, one of the companies I worked with, they use paper charts for a long time. And every time they would forget, after 7 years or 10 years, they would forget to like get rid of all the old charts. And then so we had like this whole room that had like humongous charts just being piled up. And I was like, what in God's name? What? This is overwhelming for me as someone that's coming into your company, right? So again, right? Technology helps you save all of that stuff. Prescriptions, you're able to do your prescriptions through, platforms as well. Now there are platforms like Akuro, Med Access that allows you to be able to connect with pharmacies as well. There are platforms like our copia, I prescribe. You can use all of that stuff to be able to send prescriptions rather than writing your prescription on a paper pad and sending it over there. And then the patient can like, rewrite from like maybe you write like 2 and then they change it to like an 8, all of that stuff, right? There's so many benefits of using technology, right? There are many things I can think of, but there's even compliances, HIPAA compliances. Every time there is a new update on, how we handle patient information, how we handle patient charts. I mean, they're the basic ones that, I think every healthcare professional should know. But there are new updates every time. As a healthcare professional, do you keep up with this update? If you don't, right, and something happens, you become liable, right? So having someone on your team essentially that is able to keep up with this updates, let you know, protect you. Essentially, what virtual assistants do basically is protect your best interest. Now, again, there are disadvantages in some cases, but that's just an overview of like, a lot of challenges that doctors have faced. One of the ones I really want to mention as well is definitely the turnover for employees and administrative assistants that come into your clinic. So as a clinic, one of the things that I did when I was working with one company is I looked at the ratio at which, there was a lot of turnover from the administrative assistants. Why? I mean, there are many reasons why this could be the case. But when you look into it and you see, right, you're all kind of like, okay, so every time somebody comes in, then you as a doctor have to train this person on your systems, have to yada yada yada, and the person leaves, right? And then you have to do it again, that whole process again and again and again and again. As a doctor, that can be exhausting. Where do you have that time? When do you have that time? Right? So those are just basic things that I think a lot of doctors are currently struggling with. Aside from the fact of technology, a lot of doctors don't want to change that technological aspect. I had one doctor literally tell me that, you know what, I'm too old to start using these things. I'm not sure I can really learn how to use. And I'm like, then maybe you shouldn't be practicing. you know, maybe it's time to call it quits because every time every day something new comes up and you have to learn, you have to develop the habit of consistently learning. So if at some point you are telling me that you cannot learn something that is going to help you, then maybe you really don't want to practice. That's just how I see it personally, but yes.
Right. And that actually segues into the next question I was going to ask. So, yes, it's all well and good knowing what opportunities are there, or at least being told whether you believe it or not,
Mhm.
and kind of having a bird's eye view of where things are going. But naturally, as with anything, you're running a business, you've got your own set processes and systems in place, or, be them perfect or imperfect. And there's going to be a bit of some cost fallacy in that. You feel I've invested years into doing things a certain way, teaching an old dog new tricks, so to speak.
Mhm.
How can clinics overcome concerns about losing control over their processes when outsourcing administrative tasks?
So I'm going to answer this question in two ways, right? The first way is because this is based on my experience and having worked in the industry for this long. The first way is some how do I put this? Giving your practice or your administration processes to someone like us actually will help you in the sense that we kind of look through what your day-to-day processes are like. what exactly do you need from start to finish, right? We're watching you. We don't just like come in and we're like, oh, we're going to be your virtual assistants and, yada, yada, yada. No. So we're looking at your processes. This is what I do from morning to day. I do ECGs, I do EMGs, I do all of that stuff. We master that. Once we have that and we know what your day to day processes are, then we're able to help you implement better processes. So we might not necessarily change everything if we find that some things actually work fine for you, but we will review it in the sense that, okay, for example, oh, this will work better if you use this. This will save you 2 minutes in the day. 2 more minutes you can spend talking to your wife. 2 more minutes you can spend calling your kids and checking in on them, right? So that's one way we do that, right? We don't completely take out all the processes at once. Say, for example, you don't know how to use an emailing system, or you don't know how
Yeah.
to. I know it sounds very funny, but there are a lot of doctors that tell me. I've worked with doctors that tell me, oh yeah, I'm not sure how to email. I'm like, what do you mean, Demilade? What do you mean you don't know how to email? Like, so we don't completely take it out if we know it's going to completely cause a whole rocket in your schedule. We start like little by little by little. Okay, this is what we can do. Let us remove this and start with this. Once you have mastered that, then we start to increase those other technological things that can help you. Another thing is through training, right? I think it's important that doctors and healthcare professionals in general actually consistently get upgraded on trainings. Um, Training in terms of technological things that they can use, training in terms of like new platforms that can be used to aid their care, which is another thing that we also do as well. We actually send out emails to our doctors letting them know that, there's this training that's going on. That can help your practice. Is it something that you're interested in? Is it something that, so we're not completely just coming in and like bulldozing you with like, okay, these are all the things that work for you. Akira, this, that, giving you all of that stuff. We kind of show you how this can possibly help your practice and leave it up to you to kind of decide. Now, a lot of doctors are always scared. They're like, oh, what happens if I do this and I lose this or whatever, right? Because we're training you, right? You kind of see the benefits of it. It's difficult for us to ask you to change your processes without necessarily showing you how what we're offering can actually be a benefit to your practice, right? So training actually helps, right? I know doctors are always scared, nurses are always scared that, NPs are always scared that, that bringing in a new system might disrupt things, but they need to be able to trust that we know what we're doing. We've been watching you guys for years and years and years. We see the backlogs of, 3,000 patients that are still waiting on your wait list without you finding a method that works for triage, right?
Mm.
It's yeah, it's I don't even know the word to use.
And I suppose bringing then back to specific examples of when this has worked well, could you share examples of how clinically handy has helped improve clinic operations, which obviously in return has led to better patient satisfaction?
Yes. So we have worked with a number of companies in the US. One of them that I'm really proud of that we're still working with. They are a telemedical company. They've always been a telemedical company, but they do not understand the processes of how a lot of stuff work. So where we kind of step in is with a virtual administrative assistant, right? We handle all of their transcriptions, we handle all of their scribing, we handle all of their communication with their patients. So we never actually do see the patients, right? We call them, we talk to them. Oh, this is it's important that you schedule maybe a consult with your doctor because there might be urgent findings. We do all of that for them. And this is a company that, to be honest, I believe as of last week, they'd be opening another branch in Seattle, right? They have over 10 branches, and we've been able to efficiently manage them and their resources. Now, I know everyone's going to say, this is a virtual company anyway, it's a telemedical company. But when we look at things like even working in clinics, which we have before, right? We've worked with neurology. And in that way, where it was a physical practice, we just changed certain things to become virtual for this doctor now. So, for example, all of his intakes were done virtually, right? All of his, some of his consultations, like follow-up consultations, we changed them to being done virtually. Why? Because why would I come all the way to an appointment in so location when, what you have to tell me is 10 to 15 minutes, So again, you're saving the patient's time. You're saving the doctor's time because it's just a virtual consultation. You get on your computer and both of you can look at it together. The patient doesn't have to come in, right? So that way, the doctor was able to reduce. I think when I left, they had a wait list of over. When I first started with them, they had a wait list of over 2,000, about 2,000, maybe 600 people. We were able to get it down to 1,000. So because some of them are follow-up consultations. It's not, there's some things that we can see that doctors can't see. Doctors feel like, oh, I have to see all of these patients, they're on my wait list. But then when we're reading these reports, we see, okay, this is just a follow-up consultation. This is not an actual, you don't need a whole 30 minutes to touch every part of their body to know, like, what's going on, right? I mean, there anomalies, like for example there are patients that have to come in, right? This doctor was able to increase their revenue, right, in the sense that if some of the patients, say in a day you're seeing 50 patients and 20 of those patients are follow-ups, right, and the remaining 30 are new patients. For new consultations, doctors get paid more, right? Follow-up consultation as a doctor, it's, especially when you're a specialist, it's nothing. You're not getting that much.
Mm.
Sorry to call out all the doctors that might be listening on this podcast, not coming for you, but we do understand the billing aspect of things. So we do see a lot of this stuff. So when they're having follow-up consultations, you're not getting more. Now, this doctor was able to also increase their revenue because then they're seeing more new patients. And what is actually happening is their wait list is decreasing because the more new patients you're seeing, the more the wait list gets shorter. The patients that are reoccurring patients or follow-up patients that can be had through virtual means, right? We move them to virtual. You don't have to come into the clinic. This is what it is. Doctor calls you, discusses with you, all of that stuff. That is essentially what the pandemic did, right? It showed that not everybody needs to come to the clinic. And I think that actually made the doctors realize that, okay, I can actually still make a bit more money if, like, some of my consultations that are follow up are, oh, how are you taking your medication? Is it working? Oh, do you need a change? Okay, in that case, those kind of things. Why is the patient coming to the clinic? You can have that over the phone. Okay. And then when the doctor is done, he sends, the information to the virtual assistant. Virtual assistant creates the prescription, puts his signature on it. We send it directly to the pharmacy. So the patient doesn't even have to come to the clinic. The patient just goes to the pharmacy to pick up their medication. Life could be that easy for healthcare professionals. But if they're only willing to include technology, include virtual assistants into their practice.
I love it. That sounds like a game changer. I think definitely if I had to, I was a bit unwell. For anyone listening, I have a bit of a cold as it is. So I'm thinking I need to go to the doctor after this, and hopefully it can be as streamlined as that. Be a game changer because, as you said, there's always. We had a recent podcast episode with Dr. Larry Stanley. We talked about the importance of, when dealing with your patients, tailoring to their personality types. And there's a lot of people that will frankly be very, very busy, and they might at an unconscious level perhaps be getting a bit resentful of, okay, so I need to commute 1 hour in, 1 hour back for 10 minutes that, as you said, could realistically be addressed over a call. So I think it's a win-win for everybody. The doctors number one, they got to get through their backlog. They make more revenue as a result. They're not wasting their time, frankly. Way less boring work. That's not why they went to med school. The patients obviously don't have to drive back and forth. And as you said, they still get that personal touch. So it's a win-win. And combine that with the fact of them getting their billing right, potentially avoiding missing out on a couple of 100K over a few years by trying to save expenses. And obviously that's a best case scenario. That's assuming you're not overbilling and then you've a court date and all that. I think it's great, great work that you're doing. I think it's a no-brainer. If anyone is getting caught up in the, I'm going to say boring, but that's just me. I'm sure you love it, but what some doctors may perceive as not as in not the reason why they went to med school. I think it's an absolute no-brainer. They can do more of what they love, help more people, and yeah. With that being said, Demi, where can people find out more about what you do?
So we have our website, www.clinicallyhandy.com. And right now we offer services to people, I said people, to doctors and healthcare professionals in the US, in the UK, and also in Canada. We offer virtual assistants, medical billing, medical scribing, transcription, translation services if needed, or we are able to link you up with platforms that work better for your clinic. I prefer to work with you, but if you just want recommendations, you can also give us a call and I'm happy to help you out with that. We're also on Instagram, Clinically Handy, and on X, Clinically Handy as well. And hopefully soon we will be on YouTube, thanks to Thomas and this podcast. Yeah.
Looking
Yeah,
forward
and
to
we're
it. As I
also on
said,
LinkedIn as well.
yeah. So yeah, as I said, if any healthcare professionals here are getting bogged down, they're in the weeds of all the administration work and they want a bit of work or want a bit freed off their plate, Demi and the team do a great job, and I can strongly vouch for them. So that being said, I look forward to doing this again, Demi.
Thank you so much. I had so much fun.
Cheers.